When Roosevelt took over in 1932, we had 25% unemployment. He brought it down to about 15% unemployment. And then he thought, well, looks like we got the problem pretty well licked. So he scaled back on what the government was doing. And in 1937, the economy went into another tailspin. And it didn't recover until Roosevelt resumed the pump priming in 1939. And then World War II came along, the mother of all jobs programs, and that finished the problem. But what we're trying to do is to avoid what Roosevelt did by prematurely cutting back on government efforts to expand the economy. Because if your only response to this kind of a crisis is to cut spending, you will make the problem bigger and deeper than it was before you started. And let me tell you one story in order to illustrate what I mean. 1979, Jimmy Carter was president. I saw him yesterday at the Kennedy funeral. Carter was president. Paul Volcker was head of the Federal Reserve. Volcker went to Carter and he said, Mr. President, we got a problem. If you don't cut $12 to $13 billion out of your federal budget, you're going to wind up having a deficit of $35 billion. And that's going to scare the hell out of the markets. So we sat around the table in Bob Bird's office for 2.5 weeks with our green eye shades on, with our pencils, cutting here, trimming there, scaling back there. And at the end of the 2.5 week period, we didn't cut 13 billion, we cut 16 billion. And we passed it through both houses, and Carter signed it. And guess what happened to the deficit that year? It didn't go up to $35 billion. It went up to $70 billion. Why? Because the economy went to hell. And that illustrates that if you are in a recession, your first priority has to be to get us out of it. And this is going to take a long time because we had so many stupid economic policy decisions the last 8 years. It's going to take us a long time. And the other thing we're trying to do is to deal with health care. Now, if anybody thinks we can ever get a handle on the federal deficit without reform in health care, they're smoking something that ain't legal. And let me explain what I mean. Some of our Republican friends will say, gee, why are you trying to hurry through this health care package? What are they talking about? Hurry through. We've been trying to get this done since 1933. When Roosevelt passed Social Security, he wanted at the same time to pass universal health care, but he couldn't get the votes for it. Harry Truman tried in the 40s, at a time when we were spending 4% of our national income on health care. Truman tried to get health care reform through, and he couldn't get it done. A few years later, when we were spending 8% of our income instead of 4% under Truman, when we were spending 8% of our national income on health care, of all people, Richard Nixon tried to get health care reform through. And he got beat on it in the Senate. We passed it in the House. But a weird coalition of super liberals and super conservatives in the Senate wound up in the same place. And they killed Nixon's initiative. So then we tried it again under Bill Clinton. And by that time, we were spending about 12% of our national income on health care. And he got beat. And now we're trying again under President Obama when we're spending over 16% of our national income on health care. And there's still people who are trying to say, oh, we can't afford to pass health care reform. We can't afford not to pass health care. And I take this personally. I want to tell you 3 stories to show why. First is my sister. She died of cancer a number of years ago. And the last time I visited her in the hospital in Milwaukee, she was in her hospital bed and she said, Dave, I hope I die by Friday. I said, why? She said, because that's when our insurance runs out and I don't want to leave Jack and the kids with the bills. And she died on Friday. My brother-in-law, Tom, died of pancreas cancer. Believe you me, you do not want to go that way. He was so sick that when he vomited, he broke 3 ribs. And yet, what he hated the most about that experience, he told my sister, what he hated the most was standing in line at the drugstore and seeing someone ahead of him in line being told by the pharmacist, sorry, your insurance doesn't cover this. And watching those people leave without the medicine they needed. He said that was the worst thing of all, because he felt so guilty about the fact that he could afford his medicine, but some other poor devil couldn't. And then third, my wife, back here, I don't know where she went, in the very back row, a few years ago, we were at our cottage, and she slipped on a wet step and had what's known as a supracondylar fracture. Bone, the elbow, the end of the elbow bone, shattered. Over 100 bone fragments. She went to Marshfield Clinic to get it fixed up, and she was in surgery for almost 5 hours. I was sitting in that waiting room, and there was an older fellow across the room from me, and he kept looking at me. And he finally said, are you who I think you are? I said, afraid so. And he asked me why I was there. And so I told him what had happened to Joan. And then I said, why are you here? He said, well, my daughter was loading boxcars 3 years ago. And she had a bad accident. And it really ruined her arm. And she didn't have any insurance. And so she couldn't get it taken care of. And now she's in there because they say the nerve damage is too extensive. They can't really restore much of the use of the arm. But at least they're going to try to relieve some of the pain. And I sat there thinking, my God, the only difference between them and us is that we had decent health insurance, and they didn't. That's a moral abomination, and that has to change. So what is it we're trying to do? What we're trying to do is to simply give every American the right to have access to the same kind of health insurance that members of Congress do. What we want to do is to set up a series of health exchanges around the country so that every American can choose among a variety of private health insurance plans. And then we want to add to that choice one additional thing, what we call a public option.
Yes.
So in plain language, Medicare 2. That's essentially what we're talking about. Now, I find it amusing that the insurance lobby doesn't like that. I mean, when people were talking about having a single payer system that would have cut out the insurance companies, the insurance lobby said, oh, no, my God, you can't do that. We got to have competition. We got to have competition. So we say, okay, what's that competition? If your program meets the minimum